So I'm traditionally a family physician, and I always say that I don't know that's what I saw myself doing, but sometimes I feel it found me rather than me looking for it. And I've always had a strong emphasis on geriatric care, and over time just focused more and more on it. And because of private losses and experiences, I decided to just make it the sole focus of my practice and gave up outpatient practice altogether. So I've been a house call physician now for over 10 years out of my total of 18 years of practice. It sounds like a simple question, but there are so many aspects about it that I love. I love the flexibility of it, just simply not being stuck in the same four walls every single day. I love not having a waiting room that's full of people that I have to see now in 10-minute increments. I do love the medicine behind it. It's complex, it keeps me on my toes. I manage very complex things, often on my own. It becomes overwhelming, but it keeps me just also professionally very fulfilled. And then there's the whole personal aspect of it, right? It's to see someone in their home is a very intimate experience. I think it goes beyond that professional patient-doctor relationship. It's a big token of trust for someone to let them into your home, and for me to walk into someone's home. I must trust them as well, right? So that already by definition, I think, gives you just a more connections. So I think that's part of what I appreciate, is being very connected to my patients on different levels. Yes, there is one particular patient that I really still miss. He's, passed, and I still actively miss him. And I think of him as someone who's actually, and I sometimes say this to certain people, is that I feel I get more that I can learn from them than I have to offer them medically at some point in their lives, right? That they do more for me, they teach me. I try to learn from the wisdom that they have gathered by now. And there's one particular patient who, especially during the pandemic, was always made it a point to make sure I came into his room, but from a distance, very safely. And it was this very charming gentleman, older gentleman, and he would always say, "But how are you? Tell me, how are you?" And he would just have me sit there, and I could either tell him a funny story, or I could cry, or I could do whatever I needed to do. And then he would just let me go on and do what I needed to do, and make sure you're safe. And we went through a really nice journey together until the very end. And in return, I think that I was able to help him to have what he considered a good death, and I think that was a very good learning experience for me, very personal, and I still miss him, yes.